So now let's continue with the next topic, which is body fluid compartments. And this is a very important topic. So without water, there's no life, right? It's the medium that allows all reactions that allow life to take place to happen in. So for that reason, we are on average 70% water. And if we look at this, the classification of the fluid compartments, I've already spoken about this in the previous session, but I'm still going to go into it again with a few more details. So when we look at the composition of the average human over here, like an adult male, the adult male is 60% water. So if there is a 70 kilogram adult male, then the male is 60% water and the female is going to just be 50% water. Okay, and there is a discrepancy, and this is because of certain factors, anatomical variation between male and female, mostly with the adipose tissue that makes up this one, the female body, a little more than in males. So what happens is women have more adipose tissue and fat in their body, and that's because they have breast tissue and a little subcutaneous fat in the hip region also. So if you look at this, the adipose tissue is a marker that the woman is full of good nutrition, and she is most likely going to be strong and yield children. So that's why men tend to be attracted to women in this way. But the excess of fat is accumulated at the expense of water in the female body. It is for this reason that men who are of a certain fat percentage, the normal fat percentage, actually have more water than in females, comparable females of good health, without any excess adipose tissue inside them. Just be aware that your human body is like 25% adipose tissue if you are healthy, and you need that fat. It's an endocrine organ. It's an organ that cushions your internal organs from shock and injury, and also it is a source of reserve energy. So it's not bad to have adipose tissue. 25% is an excellent amount. It's a very normal amount to have, and you shouldn't have more and you shouldn't have less of that. Of course, there are exceptions with certain athletes and people who live certain lifestyles. But anyway, so if you are a 70 kilogram male, then your total body water is 60%, so that comes to around 42 liters, like we said. Now this 42 liters is divided into two compartments, and I'm going to elaborate on it even more. The first one is the intracellular fluid compartment, intracellular fluid compartment, which is all the fluid inside the cells. So we'll call this ICF, intracellular fluid. And the other is extracellular fluid. Okay, so extracellular fluid compartment. Now, what happens is, if you see the intracellular fluid compartment, this is made up of 2/3 of your total body water. So that comes to around 28 liters. Okay, and your ECF is 1/3 of your total body water. That comes to around 14 liters. 14 liters. Now, when we look at the this one, extracellular fluid compartment, there are again further divisions over here. So I'd like to say that the most important of divisions are interstitial fluid compartment, interstitial fluid compartment, and along with that, we have another compartment called the mesenchymal fluid compartment. Now, it's less spoken about, mesenchymal fluid, and this is the fluid that is in your connective tissue, bone, and cartilage. And finally, you have something which is not exactly ECF or ICF, it's transcellular fluid, but we'll just club it under the ECF over here. So these three compartments make up around 75% of your ECF, 75% of your ECF, or 3/4 of your ECF, 3/4 of ECF. So that comes to around 11 liters. So that is around 11 liters over here. So this 11 liters makes up your interstitial fluid compartment and transcellular and mesenchymal. Transcellular is just 1 liter from this. And so what are these compartments? I'll be elaborating on a little more. First, let's just get the divisions down over here. Now, we have another compartment called plasma in the ECF, and that is 1/4 of the total ECF, and that comes to around 3 to 3.5 liters. So let's say 3 liters. This is your plasma. Now, how do we just make sense of all of this with a diagram? So imagine your vascular system. So you have blood vessels over here, and the blood vessels in the vascular tree have got cells inside them, and the cells are made of RBCs, WBCs, and platelets, which are cellular fragments. And these cells are the cellular components of your blood in the vascular tree, and you have plasma on top of that. So I'm just going to shade the plasma in red over here like this. And then we have other cells outside the vascular compartment, like in your organs, your neurons, your nephrons, your liver cells, your epithelial cells, your any cell you could imagine over there. So we have different types of cells in the body. And now look at this, the fluid inside your red cells, white cells, and platelets in the vascular compartment, and in your cells outside the vascular compartment, which are within the cells. This is all ICF, intracellular fluid. All right, and this is the 28 liters that we spoke about. This is intracellular fluid. This is 28 liters, and the 70 kilogram adult male. All right, and if we look at plasma, plasma is the extracellular fluid in the vascular compartment. So plasma, which I shaded in red over here, is around 3 liters. This is around this is the extracellular fluid that covers and that surrounds your red cells and white cells and platelets. Then in green, I'm going to shade this fluid which is outside the cells and outside the vascular space. This is the ECF of the extravascular space, and this is your interstitial fluid compartment. So interstitial fluid compartment. And this is the milieu interior that Claude Bernard meant when he spoke about the internal environment of the cells of the body that determines how whether life will thrive or not, and whether you're in homeostasis or not. You need to have constant conditions of this internal environment. Some people use ECF interchangeably with milieu interior, but Claude Bernard actually meant by interstitial fluid, to be more precise. But in a way, if you look at it, ECF, plasma, and interstitial fluid both make up ECF, and certain changes in plasma immediately get transmitted or get manifested even in the interstitial fluid, because they're quite close to each other. There's a very thin capillary membrane, that is endothelial membrane, that's separating plasma from interstitial fluid. So most of your most of the constituents of plasma and interstitial fluid can easily exchange, with the exception of plasma proteins, which are very large proteins that just don't make it across the plasma membrane so easily. So that's why sometimes people might say ECF for that internal environment which we were speaking about. Anyway, so that is the interstitial fluid compartment. Then we have the mesenchymal fluid compartment. So this mesenchymal fluid compartment is again part of the ECF, but this is the ECF which is more in the connective tissue, in the bone and cartilage. And along with the transcellular fluid, it makes up 3 to 3/4 of your total extracellular fluid compartment. Now look at transcellular fluid. This is fluid which is present in your pericardium, peritoneum, and pleural spaces, and in your synovial joint spaces as that lubricating fluid over there, and in your eyeballs, in the aqueous humor, vitreous humor. There's some water over there and places like that. So that all adds up to around 1 liter, and this is your transcellular fluid compartment. It's a fluid that is lined by epithelium. It's stored in some sort of a separate compartment lined by epithelium. So that's transcellular fluid over here. So this is the classification of your body fluid compartments. Now, if we speak about the determinants of your transcellular fluid compartments, of your body fluid compartments, there are some things you should be aware of. There are variations. It's not always the same, like I said, between gender, but also there are other factors like age and your body fluid composition. So when we look at the body composition, I just like to speak about that for a minute. So your body is made up of skeletal muscle. So I'm just going to write it over here. Skeletal muscle is around 36% of your entire body weight. Non-skeletal organs, non-skeletal tissue is around 29%. Then you have adipose tissue. This is around 25%. And then you have bone. Bone is 10% of your body weight. So 10% of your body. You can just put everything in your body, every cell, every tissue, into these 4 categories over here. Okay, so you could see that adipose tissue takes 25%, skeletal muscle 36% over here, and adipose tissue is 25%. So now in some people the adipose tissue is more. People who are able to consume more calories than they are able to burn. So they tend to put on a little more weight and tend to be obese. So these people have more adiposity, more adiposity predisposing them to the obesity and many other chronic illnesses. But the point is that if you have excess adipose tissue does not have too much water. Remember, fat repels water. So for that reason, the water content becomes less. So what are the determinants of your body fluid composition? First thing is, let's just talk about adipose tissue. So adipose tissue is going to be a major determinant. The more adipose tissue you have, the less you have body fluid, total body water. So it's inversely proportional. I've written 1 over TBW in this relationship. Okay, this is adipose tissue. Next thing you should know is that it is there's the other thing, which is age. So age, if we look at it, when you are born, you have more water than when you age. So the most water you have is actually when you are a newborn baby. So if you were a full-term baby, you would be 70% water in a newborn baby. And the ratios that you saw over here, 2/3, 1/3 between ICF versus ECF, it doesn't apply. When you are born, your ECF is actually more than your ICF, and not the other way around with the 2/3, 1/3 ratio. And as time progresses, by the 3rd month of your life, by 3 months, the ECF equals the ICF by 3 months. So in a newborn baby, your ECF is more. Because your ECF is more, remember this, because the extracellular fluid compartment is more, this ECF is much closer to your lining epithelium. I want you to think of it this way. The lining epithelium of your mucosal surfaces and of your skin. So well, that means exchange happens at these epithelial surfaces, and if you have more ECF, there is more exchange that is likely to happen, and hence you might be able to lose more fluids from your body when you're a newborn baby. Hence you are more prone to dehydration. There is much higher chance of dehydration in newborn babies, much more chance of dehydration in newborn babies than as people grow older, because they have more ECF volume than ICF. And then 3 to 4 months, the ECF matches the ICF, and after that, as time progresses, the ICF will become 2/3 of your total fluid body water, which is more than the ECF, which is 1/3, and this happens by 1 year of age. So the change is happening gradually over 1 year of age, but steadily until the age of 1 year, then changes occur. Following this, as time progresses, now you start to grow older and older, and eventually you hit puberty. So the next thing that determines the water fluid compartments is sex, your gender. So females, like I said, have lesser water than males, because when you become 13 or 14 years old, and if you look at girls, they undergo something called telarchy. So telarchy is the first sign of puberty. It's where the breast tissue starts to grow. This happens even before they have their first period, or before they even develop hair in other regions of the body, the pubes and the axillary area. So telarchy is the enlargement of breast. This is the first sign that the girl is maturing. And as the breast tissue starts to grow, I told you it's adipose tissue, and this adipose tissue expands in volume at the expense of water, because there's less water in adipose tissue for that reason. So it is the women after puberty, after the age of 13 years or around 13 or beyond that. So that's when these women tend to start getting a ratio of 50% water compared to the male 60% over there. And that's how it is. Now, as you grow older and older, also, I'd just like to emphasize that your total body water gets lesser and lesser. So if a male who is young has 60% water, then by the time he's around 60, he will be 55% water or even 50% water. And for women who are like at the age of 60, they could even have as less water as 46%. So you could see that with old age, your skin gets less turgor and less elasticity, and that's one of the things is because of dehydration that happens with old age over there. So you have to be aware of these changes over there. Now, when you look at some other important facts I'd like to just emphasize upon. So these transcellular fluid compartments, we have got the pleura, the pericardium, and the peritoneum. Let's just talk about this. So the pleural fluid is around 10 to 20 ml of fluid that exists between your pleural lining. So your lungs are covered by pleura. There are two layers, the visceral layer and the parietal layer, and you have 10 to 20 liters of fluid that acts as a lubricant and prevents too much of friction from heating up your internal organs. Imagine your lungs are expanding and contracting and rubbing against the thoracic cage, and every time you breathe, you are having an organ rubbing against another organ. So you can imagine there's going to be a lot of friction and a lot of heat in the body, and the internal organs will heat up. For that reason, we have a pleural fluid over there that's around 10 to 20 ml, and that's very important for lubrication. Okay, and we don't want too much of it. Sometimes this can increase in conditions of inflammation when there are infections or even autoimmune conditions that can cause extra fluid to ooze into the pleural space over there, sometimes with white cells. So that again is going to be a topic covered more in pathology, but I just want you to be aware that these fluid spaces like pleura, pericardium, peritoneum, they can also expand. So the next one is the pericardial fluid. Pericardial fluid is the fluid that is present in the pericardium, which is again a lining epithelium of your these two layers that exist lining your heart, and it again causes lubrication, because with every heartbeat, otherwise you'd have plenty of heat that is going to be created in your chest, and that won't be good. So that's around 50 ml. And then you have your peritoneal fluid. So the peritoneal fluid, the value changes in females with regard to the menstrual cycle. So you know that the female has a menstrual cycle that takes place. So in what we call the early luteal phase, it's around 20 ml, and in the late luteal phase, it's 5 ml. So this was in females. Okay, in males, it's almost zero. There's hardly any fluid in the peritoneal cavity. You should be aware of. And so this is part of the transcellular fluid. Along with that, you have fluid that is in every little synovial joint. So from your knees to your elbows to your the joints in your fingers and the phalanges and in your toes, you have got this kind of lining which is filled with a lubricating fluid. Actually, one of the most slippery substances known to Earth and known to mankind. And this is your synovial fluid, made naturally in nature. So the synovial fluid is very, very slippery, and it's made naturally by our body. There are hardly any other substances that can match it in slipperiness that we could even make in a lab. So this is around 1 ml for every joint that we have, and if we count all the joints that we have and the fluids that we have, all of these volumes add up to around 1 liter.